I'll just add that everyone at Paloma is very excited because we have a huge number of people who have signed up for today's speaker series event with McCall, McPherson, and Julia Schopick. And we are very excited to be talking about low dose naltrexone, LDN. It's a topic that is near and dear to all of our hearts because McCall is prescribing it. Julia has been advocating for it and I believe takes it. Alex is very knowledgeable about it and takes it as well. I have taken it and I have worked with a lot of coaching clients and encouraged them to explore it. And so we are all very big fans of this really not as well-known therapy that may in fact be a great help for people with autoimmune disease. So we're really excited to be bringing you this all-star panel of our two experts to talk to us today about this.
So excited to be here. And I too am on it. So we're like a powerhouse,
Okay.
ladies.
All
Yeah.
right. So everyone's got the personal experience. This is terrific.
Yeah, thanks, Mary, for that introduction. So I'll just go ahead and get started. Some housekeeping rules. We are Paloma Health, an online medical practice solely specifically focused on treating hypothyroidism. Just a couple general things for you guys to know. We are currently live streaming in our community. So if you have any Q&A questions that you want to ask either Mary, McCall, or Julia, you can do so in the community. That will require you to log in and create an account and then go ahead and post your comments there. But any questions that you have for our live Q&A, go ahead and feel free to enter them throughout the conversation. And then when we get to that segment later on in the conversation, I will go ahead and send over those questions for Mary to ask our panelists. So without further ado, I'm going to go ahead and pass it off to Mary Showman, and she'll take it away.
Great. Thank you, Alex. We're really excited, as I said, about today's event because we're really focusing on a topic that could be of tremendous benefit to people with Hashimoto's and hypothyroidism, but isn't always very well known to them and even to some of their practitioners. So today we are going to be joined by McCall McPherson, who is a physician assistant, and she's got about 22 other hats that she wears. She runs the Modern Thyroid Clinic, which is an Austin, Texas-based clinic focused on thyroid treatment. She runs Thyroid Nation, a popular patient advocacy website. And I think she's probably doing about 25 other things at the same time. But she is really one of our favorite thyroid gurus and experts. She is hypothyroid herself. And that was really in many ways the driving force that got her into all of this. And we also have Julia Schopick with us. Julia is a patient advocate, very dedicated, a writer, and really an all-around expert on how to really speak up for yourself in the terms of getting your own healthcare. She is the author of a best-selling book about low dose naltrexone called The Power of Honest Medicine. And she's going to be sharing information with us as well about how to get LDN and a little bit more about the history, because she's got some personal connections to the people that found out about LDN in the first place. So we're going to go ahead and start by having our expert panel introduce themselves. So they're going to take a couple minutes just to tell us who they are, why they're particularly interested in thyroid care, and a little bit about their LDN experience. And after we have introductions from both McCall and Julia, we have some questions that we put together at Paloma based on questions that I get, that Paloma gets, that everyone gets about LDN. And so we'll go through those questions. But again, as Alex mentioned, once we've gone through our list of official questions, we will be opening it up for viewer questions. So if you're registered in our community, you'll be able to leave your question in the chat area, and Alex will make sure that we get your question to McCall and Julia so that we can answer them live today during our broadcast. So first, I'm going to start by introducing McCall, and I'm going to give you a little more background on her. I gave you the sort of highlights. She's a licensed and nationally certified physician assistant with prescriptive authority. So she does prescribe medications, as most physician assistants are licensed to do. She runs and founds the Modern Thyroid Clinic, a clinic focused on thyroid care. She's also a nationally known patient advocate and the owner of Thyroid Nation, an advocacy platform, great website. She is really always been passionate about perfecting thyroid treatment and taking it to the next level based on her own situation where she was mismanaged in terms of her hypothyroidism care. And that's why she was driven to found Modern Thyroid Clinic, where she's taking care of pretty much everyone she can who needs any help with their thyroid. So she's a multi-purpose, kids, grandparents, men, women, everybody that needs any kind of support in thyroid. So you can find her at modernthyroidclinic.com and McCallMcPherson.com. And so I want to welcome, first of all, McCall McPherson. Thank you for joining us.
Hi, you guys. I'm so happy to be here. I have loved Paloma since I heard about you in the thick of COVID, when no one could go get labs and everyone was stuck at home, and you guys just came in and saved the day. So I really appreciate the work that you do. That was the best darn introduction a girl could ever ask for. So I'm not sure what in the world I could add, but yes, so I am a thyroid patient gone expert. It's really my belief that, with proper thyroid care, not only can Hashimoto's and Graves' disease be reversible, potentially even put into remission, but also you shouldn't really have thyroid symptoms anymore. So if your clinician, your doctor does their job well and right, this should not be something that you struggle with forever. So that's my whole motto. My whole motto is there's no reason to still have thyroid symptoms. You can find me, yes, on those websites. My most fun venture of late is TikTok. So McCall McPherson at TikTok. It's been a blast. So thanks for introducing me to TikTok world. It's fun. And I'm happy to be here today.
Thank you so much, McCall. We're really thrilled to have you here. And I'm also going to introduce Julia Schopick. Julia is, and full disclosure, I've known Julia for more than 20 years, and there is no one who is a more energetic and truly tireless advocate for patients than Julia. She's been a lifelong patient advocate. She's a best-selling author, a podcaster. Her podcast will be coming out soon, so stay tuned, and a public relations consultant. She created her blog, honestmedicine.com, back in 2006. That was a year after the death of her husband, Tim Fisher, who was a 15-year brain tumor survivor. And as far as I'm aware, he was given a very short time to live. And then with Julia's advocacy and support and all of the research that she did, he ended up far exceeding anyone's expectations in terms of his long-term survival. But it was her experience taking care of Tim and advocating for him that inspired her to really share some information that she learned about the world, with the world, about little known treatments that extend lives, treatments like those she found for her husband. So Julia's first book was called Honest Medicine, Effective, Time-Tested, Inexpensive Treatments for Life-Threatening Diseases. Long title, filled with incredibly valuable information. The book featured a section on low dose naltrexone that turned out to be extremely popular. Julia was interviewed for her book for like 200 times on radio, talk shows, internet, TV, everything you can imagine. The book's been translated into multiple languages, released across the globe. And then her second book, The Power of Honest Medicine, LDN, an inexpensive alternative to the costly toxic medications doctors prescribe for autoimmune and other diseases. Julia likes those titles. This book focuses on stories of patients taking LDN for autoimmunity across the globe. And so you can find Julia at honestmedicine.com. And so Julia, welcome to our speaker series, and we're thrilled to have you with us.
Thank you. And I will tell a little bit about how I became interested in LDN. You gave a very good bio of me, so I don't have to repeat that. But I can tell you that I was introduced to LDN more from the cancer point of view, if you want to know, because as you pointed out, my husband was diagnosed with a cancerous brain tumor. That was in 1990. And, I did all these treatments, just like Mary said, to extend his life. But he did have a recurrence in 2001. And we were like, I'm not going to go into details. That's all in Honest Medicine. But I got a call one day from a dear friend named Dennis Roth, who is now not with us. But he said, his son had a cancerous brain tumor, even more serious than Tim's. And Tim's was very serious. The son Jeff had a glioblastoma. And Dennis said in his characteristic way with his New York accent, you gotta call this guy named Dr. Bernard Bahari. And I said, what? Who? And he started telling me about this very creative man who had developed something called low dose naltrexone. And he said that his son is on it and you should get Tim on it. And besides, a whole bunch of people with autoimmune diseases are now taking LDN because of all of Dr. Bahari's hard work and just, persistence and all of that. So, I was like, okay. And we got it from, by the way, I have to tell you that when Tim was in the hospital, of course, they confiscated his LDN, of course. But in any case, I'm laughing, but, nothing can be done. Anyway, so after Tim died, as Mary pointed out, I decided that I had to get the word out there about conditions and treatments that doctors just won't know about and patients won't know about. And you know what? I had been so active in researching for Tim that all of the treatments I had known about beforehand, it's like that I found out about. One of them was the ketogenic diet. Another one that saved his life was Silverlon. It's a treatment symptom for a treatment system for all non-healing wounds. Another one was intravenous alpha lipoic acid, and of course, low dose naltrexone. Well, as Mary pointed out, I went on over 200 talk shows, and it was like a tsunami of people who were interested mainly in LDN. So I then wrote The Power of Honest Medicine. And by the way, one of the chapter contributors is named John O'Connell, and he has Hashimoto's. And so that is one of the chapters. There are people with all different diseases in it, and people from all over the world, who participated in this book. So that is how I came to know about LDN, although I don't know as much about thyroid disease, but Mary handles that. And so does McCall. And so does Alex.
Right.
Okay.
Thank you, Julia. We're thrilled to have you with us. So as you can see, folks, we have, like I said, it's an all-star panel tonight with our two experts on LDN and thyroid. And so we're going to go ahead and jump into our formal questions to get started. So we're assuming that a lot of folks that are joining us are already familiar with LDN, but I'm guessing there are some people who may not know exactly what it is. So our first question is for McCall. And McCall, if you can tell us what naltrexone is versus low dose naltrexone, because people get very confused about that, and what they're used for and how they're different. So if you can explain to us a little bit about that difference.
For sure. Absolutely. So, when you go to your doctor and you want to talk to him about low dose naltrexone, their first thought is the conventional normal medication, which is plain old naltrexone. So to give you guys an idea about regular naltrexone, it starts at 50 milligrams, 50, and it goes up to a few hundred. Largely, this medication is used as an opioid blocker. Okay, so it's what's called an opioid antagonist. It blocks pain medication. It also blocks your natural opioids, which can be used for addictions of most any kind. It's even used in part of Contrave, the weight loss medication, because it starts to impact your kind of subconscious cravings. So it really is great for curbing that, but that's at high doses, right? So it ends up blocking opioids. When you make it into microscopic amounts, and most people that prescribe LDN start at 1.5 milligrams. So think about that compared to 50, and they increase up over a few weeks to the total amount of 4.5 milligrams. So it's about a tenth, roughly, as potent as traditional naltrexone. And what happens when you make it into that microscopic dose is pretty interesting. So it's the complete opposite of what naltrexone normally does. So the thought behind it is that it blocks a tiny, tiny amount of our endogenous opioids. Okay, so it suppresses it just enough to tell your body, hey, we actually need more opioids. We're in this deficit. Your body surmounts that deficit, and it actually leaves you in a state of excess opioids. Okay. What that does when you're walking around with this slight increase in opioids is it reduces inflammation of any kind. And what we know for autoimmune disease in the world of functional medicine, at least, autoimmune disease is driven by inflammation. So if we can find ways to reduce people's inflammation we can reduce the burden of their autoimmune disease. So this lowers inflammation of any kind, which, in turn reduces antibodies in times. It can also has implications in cancer. So it can prune off weak cancer cells. So completely different mechanism of action than traditional old naltrexone that's used for, addiction and narcotics.
Great, thank you. And one thing I just wanted to ask if you can clarify, because I've had a lot of coaching clients who went in and asked their doctor if they could talk to them about naltrexone, and the doctors thought that they were talking about naloxone. So, how do they make sure that if they're talking to a doctor about naltrexone, that they're clear to the doctor we're not talking about high dose naltrexone, we're not talking about naloxone, we're talking about something different.
Yeah. Definitely. So the cool thing about naltrexone that Julia touched on is there's actually a lot of studies for this medication, for it being a non-pharmaceutical based medication. And in fact, every time I look on PubMed, which is where clinicians go for medical literature and research, there's new studies out for different diseases, different conditions. It's crazy. It blows my mind. So, show up with some studies so that they have an understanding. There's definitely a shock factor when you go to a doctor who's completely unfamiliar with LDN and you ask them for naltrexone. They're like, whoa, 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 whoa. Are you crazy? No.
Right. Okay. Thank you very much. All right. Our next question, Julia teased us a little with some personal connection to Dr. Bahari, but, and you started to tell us a little bit about Dr. Bahari being kind of the pioneer in the LDN world. Julia, can you tell us a little bit more about how Dr. Bahari came upon the information that LDN could be specifically helpful for autoimmune diseases, and why we're still having to be out here educating everyone about why autoimmune diseases might benefit from LDN, and so what was Dr. Bahari's role in all of this, and where are we going with this with autoimmune and LDN?
Well, Dr. Bahari's role was as the person, and he probably is not well known enough, although he is known. His name is known in the LDN community. I think I will start by saying that Dr. Bahari, it was one of those things of the perfect person at the perfect time, coming in, because Dr. Bahari was, he was a heavy hitter. He was Harvard educated, double board certified in neurology and psychiatry. He went to the best of the best. He taught in all these different universities, Boston based, New York based. And then he was tapped by the commissioner, by the politicos in New York, and he ran all the methadone clinics. He was the supervisor of all the methadone clinics, 41 methadone programs in New York. And in 1974, he was the New York City addiction commissioner. So, oh my God, right? So, and that, by the way, I'm leading into something near the end here. So when naltrexone was FDA approved in 1984 for heroin addiction, Dr. Bahari was working with heroin addicts, and he was like, oh, I will, he was very curious and wanted to try anything that might help his patients. And McCall described how it worked, so I won't go into that. Thank you, McCall. But basically, he did give it to several of his patients at what was available, 50 milligrams, right? And he describes how they just, it was toxic at that dose. He said they got depressed, they were hyped up, like they were on, jumping jacks or something. And he said even worse, their cognition, what they had done the day before, they couldn't remember. Because it was affected them so badly. But he did notice a lot of them had what later became known as HIV/AIDS, and he did notice that this was stopping the progression, or at least making it slower for their symptoms, for the disease. So he said, I wonder if I could lower this dose, and how far would I go down for it to keep what he called its immune modulating characteristics. How far down could I do it? And he did this carefully. He went from 50 to 48 to and then he finally gets to 3 milligrams, and it's still doing its job. It's still doing it. And just about at that time, so the story goes, I don't know exactly, his daughter Tamar had a friend, according to the story, and it may be an urban legend, we don't know, had a friend who had multiple sclerosis, and nothing was working. There was no FDA drug at the time, for multiple sclerosis. So she said, why don't we try this LDN? And they did. And this is, again, the story that it stopped her MS in its tracks. And so, remember, this was all before the internet phrase. All people had was a pencil and paper, or a pen and paper, and the telephone. And word got around that this man named Dr. Bernard Bahari was treating people with autoimmune diseases in New York City. And people came to him. And he really, he just, now, so he was like the messenger, I call him the pioneer, and I also call him the inventor, actually, because he lowered the dose to it was a whole new drug, as McCall pointed out. Now we get to the question of why didn't more people know about why didn't more doctors prescribe it? I think there's one answer, and there's several answers, but I'm going to go into one. Dr. Bahari, and this, his widow, Jacqueline Young Bahari, wrote the foreword to The Power of Honest Medicine. And she tells the story about how this man, who was he was just so well known and so revered is the word, because of his background in the area of drug addiction. Any paper that he would submit to the prestigious journals would get published until he founded Low Dose Naltrexone. Then there was a blackout, and they would take none of his papers. And he was puzzled. He was a very naive man. And he actually said to Dr. Bert Berkson, one of the heroes of my first book, Honest Medicine, they were friends. And he goes, I don't understand. Why aren't my papers being taken now that I'm pioneering low dose naltrexone? And Dr. Berkson was nice. He goes, well, he didn't say, don't you get it? But that to my way of thinking, and I think I may be the first person who's saying this because I just realized the connection. Had he been allowed to publish case studies, and he even did some studies himself in the reputable journals, I believe that LDN would have become the standard of care way back then. But it wasn't. So that's the sad and the good. But he would have been delighted to see what's going on now. He really would have.
Thank you, Julia, for that firsthand insider information about the birth of LDN.
Oh.
So if you're watching this and you're not already excited about the idea of LDN, now you know what it does, basically how it works, and you know some about how it really is kind of incredibly groundbreaking, even though people don't always know about it. Let's get into the nitty gritty. McCall, if we're talking to a Hashimoto's patient, a Graves patient, a hypothyroidism patient, what can LDN do for them? How can it specifically benefit them?
Yeah. Well, first I have to say, Julia, I bowed down that you had so much experience with LDN so long ago, and just talk about a pioneer. That's actually you still,
Oh.
I remember when I first started prescribing it, it was such a rare thing. And that was probably 8-10 years ago. And people would come to see me just for the sheer fact of that I would prescribe it because they couldn't find anyone. But that was way long even before that. So props, sister, props.
May I say something?
Of course.
I'd also like to give a shout out to somebody who probably isn't listening at the call. Her name is Linda Elzagood, and she has contributed to both of my books. And but that's not her claim to fame. Her claim to fame is that she is the founder of the LDN Research Trust.org. And Linda, by the way, everybody calls her the Energizer Bunny, because she has MS, and as she says, LDN saved her life.
Yeah.
So she has made it a life purpose to spread the word. And if you go to ldnresearchtrust.org, you will see that she has a radio show, a TV show, she does conferences all over the world, and so she's, it's a combination. And here's the deal, it's patient advocates who have gotten the word out, and there are
100%.
loads of books about LDN. By Linda has written some, I've written two, she's written, I think she's on her third, I think. And it's just like, this truck that's rolling on,
Yep. With or without like a formal type of medication that you can get from Walgreens, prescribed by your insurance or paid for by your insurance. So we're going to plow forward and we're going to make it happen for so many people. It takes a team. Yes. So going back to how I use LDN with my thyroid patients, how it benefits thyroid patients. So, basically when I deal with an autoimmune thyroid patient, whether it's Hashimoto's, whether it's Graves', of course, we want to fix their hormones, right? That's a huge thing in terms of their quality of life. But in addition to that, and completely separate from that, we want to try to influence their antibodies. Okay. So for Hashimoto's patients, what that means is decreases in medication, or not constant increases in their medication over time, rather, I should say. If we can decrease their antibodies, it shows a risk reduction for developing other autoimmune diseases. Because if you have one, your chances of developing another are over 30% increased. So we want to find ways to influence these antibodies. The type of medicine that I practice views those antibodies as a direct correlation to your level of inflammation. Okay. There's a lot of things that influence our inflammation: food, our gut, our genetics, our environment, our stress, all of these things. Some of them are a lot more modifiable than others, right? So food, if we know what foods are driving inflammation, of course we can take those out. We can't change our genes. We can't move out of our city or our home because potentially it's causing inflammation. So a workaround is really advantageous. LDN, irrespective of the source of inflammation, simply takes the volume on the inflammation and turns it down. It doesn't matter if it's your genetics. It doesn't matter if it's your environment. It doesn't matter if it's your gut. Not saying that we don't want to improve these root causes, right? We do, of course, but sometimes that's not enough. So, being able to influence that in a positive way and have sort of this override mechanism is a really, really big deal. So, Graves' patients, I want to touch on that because I feel like they're always so left out of the conversation. They feel so neglected. So the way that I use LDN in Graves' patients is pretty profound. I actually think 100% minus one that I just saw for the first time this week, 100% of my Graves' patients are on LDN. And the whole issue with Graves is the higher these people's Graves' antibodies are, the more large the swings in their thyroid happen. So they're hyper, then they're hypo, and then they're really hyper. With LDN, from day one, if we can start it as quick as possible, it takes what I call the Graves roller coaster and those giant swings, and it reduces them. So the quality of life of these people profoundly improves. Their ability to function in life profoundly improves even before we deal with the actual medication component.
Terrific. So we're hearing just a number of incredible benefits for thyroid patients, whether it's Hashimoto's, Graves' disease, or hypothyroid patients in general, and in terms of other symptoms as well, because of aches, pains, general well-being, all of these things can be positively affected by the use of LDN. Julia, you being the sort of tireless patient advocate, what should thyroid patients who are taking LDN be aware of? And I know you're not a doctor and you're not a practitioner, so you're not going to give us medical advice, but what types of things should a patient go in if they're going to be a prepared and empowered patient when they're talking to their doctor and maybe they're talking about LDN or they're getting prescribed LDN? What kinds of things should they be thinking about or questions should they be asking?
Well, I think first of all, thank you, McCall, because you basically answered that, but I'll just tell a few things. Okay. So my answer won't be too long. They should definitely get tested because, as you said, things change in their antibody situation and all of that. So they should be frequently tested. And so the doses can be changed. Then I want to bring out about the side effects. And actually, most of the side effects that LDN gives are positive. So I don't know what word we should use. You know how with most drugs, the side effects are all, including death,
Right.
death. And for some of the MS drugs, PML, a dangerous brain infection, is one of the side effects. I'm using that because it's, it'll kill you. But with LDN, most of the side effects are good. Increased energy, increased mood. One of the people in my first book, Honest Medicine, wrote about how some people were taking it for depression, and now they are, taking it for depression. But there is one side effect that I want to make people aware of, and that is, and it's often resolves after taking it for a while, but Dr. Bahari had said to take it at night before bed. And McCall, well, I'll ask that later, but some people get vivid dreams and other side effects, insomnia, and it affects people differently. For instance, my mother, who died in 2019 at the age of 102, she had a kind of slow growing cancer, and she was taking LDN for years, and and she called me the day she started. After the first 2 days she started, she goes, I love it. I'm enjoying my dreams so much. I said, oh my God, So it didn't bother her. She was happy, But there was one person in my book, Kathy Shu, and she in the Power of Honest Medicine, and she has psoriasis, and she had trouble taking it at night. So she changed to the morning. And psoriasis, you cannot have a placebo effect because you have the rash and all of that.
So
right?
true. Objective.
There's an objective thing. Her rash, she showed me pictures. Her rash went away with the LDN, even when she was taking it in the morning. So therefore, but that I should tell about that side effect. Also, one more, and that is you cannot take it with opiates. You cannot take LDN with opiates. And so if you're having pain on any pain medication that is an opiate, you can't take it. Also, when you're going for an operation, obviously in a lot of the anesthesias, there are opiates. So you've got to stop it. Now, I had a personal experience with that. And as Mary pointed out, I do take LDN, and I had emergency surgery for a hernia. And of course I had taken LDN that day, and yeah, it hurt. My opioids were not blocked or whatever. The opioid receptors were not blocked. And Skip Lenz, I want to give a shout out to him because he is the person he's a compounding pharmacist who is retired out of Boca Raton, Florida. And I hope maybe he's on the call in the audience today. But he said that he used to tell people 3 days before or 4 days before and 3 or 4 days after. And he called me one day, he goes, I've changed it to 7 days before and 7 days after, because he talked to somebody. They used to call him at Skip's pharmacy, and he would take time to talk with everybody. And he said, I just got reamed out, because somebody had breakout pain, and so I would advise, I'm not a doctor, but I would advise watching out as far as taking it before an operation.
Thank you, Julia. McCall, back to you. You've been obviously working with a number of patients, Hashimoto's and hypothyroid and Graves' disease patients. What has been your experience with patients? Do most of them tolerate it well? Have you had some success stories, or maybe it didn't work for some people? I mean, I'm an example of a patient who did try LDN. I spent about 5 or 6 months taking it. I didn't have negative side effects, but it didn't change my antibodies and did not really have any significant effect. And my doctor was very open-minded, and she said, look, let's try you on it and see. And if you don't have any benefit after 4 to 6 months, we don't have to keep going with it. So I eventually stopped taking it. But I've also coached with lots of people who swear by it and love it. So what's the story? Do you have a percentage of people you think benefit from it, or just a ballpark on it?
For sure. So I'm all about data. So I love that you just asked if I have like percentages, because that's how I arrange my whole life, is around percentages. Okay, so going back to kind of the initial question of how well do people tolerate it, that kind of thing, I find, so I put probably between 100 to 200 people on it a year. I might have 2 people, maybe 3 tops a year stop it due to side effects. So in my opinion, extraordinarily well tolerated. 98% of people take it before bed. The number one side effect is exactly what Julia mentioned, vivid dreams. Not bad, but like definitely you're on an adventure. There is a small percentage of people, I would say less than 5%, that get stimulated from LDN and they need to move it to the morning. What I've found is those people that do take it in the morning, they are the quickest responders and tend to get a lot of the physical feelings of improvement for LDN. And in my opinion, what ends up happening in the community of LDN is people get an idea that they should immediately start feeling better, right? There's this almost wives' tale of, look, I took it, and it's like 5 to 8% of people who completely their lives change in 3 days to 2 weeks, and they're shouting it from the rooftops because for them it's a miracle. So I think it falsely sets a bar for people that, oh my gosh, I'm going to take this and everything's going to feel so different. Of course, that happens for some people. But what I've found in my practice is it's a long game. So I've found LDN will continue to reduce people's antibodies, their inflammation, for up to 18 months before their total level of inflammation levels out and they coast. So I encourage people, look, don't give up on it too early. Like don't, give it a long time to see the efficacy because it's working more and more over time. To give you like some ideas of what I've seen a Hashimoto's patient, their TPO antibody, which the range that I'm looking for is less than 34, especially for people who have a history of Hashi. I saw their antibodies drop 500 points in 3 months. Wow. So there's not really a lot of ways outside of LDN that I can elicit that kind of a response in antibody levels. I see it very, very quickly markedly reduce Graves' patients' antibodies, and it allows me to take control more over their thyroid function, where these people are generally pretty out of control. So big changes. Now, does it work for everyone? No. It definitely doesn't work for everyone. Some people's antibodies, they just kind of will slightly reduce or just stay the same. I had one person ever where I think their antibodies increased. I can't verify it was due to LDN, but it was a weird timing thing. So there are outliers for sure, but the vast majority of people, great responses on their antibodies, other, joint pain kind of things, overreactive gut issues, overreactions to food improves. And then just like Julia said, it has a long-term health benefits. I personally will be on LDN forever for the cancer protection, for the slowing of the breakdown of my body over time, for protection against autoimmune diseases, even though I don't have one anymore. But yeah, so I found it to be profound. It's something that I use pretty much every day in my clinic.
Mm-hmm.
I was long-winded, but.
No, that was great. I have one more question for you related to this, McCall, because one of the things that people don't know about LDN is that there isn't a drug company brand of LDN. LDN is what's called an off-label use of naltrexone. Can you explain what that means to people? Because they may think they're going to go get, Pfizer LDN or, some company, and it doesn't exist. It's a different it's a prescription drug. It's not over the counter. But can you explain a little bit more about what an off-label use of a drug is for people?
For sure. So, medications are often manufactured, FDA approved. They go to like your normal pharmacy, like Walgreens, your insurance covers it. Okay. That takes billions really of dollars going into this medication to make it FDA approved to allow your insurance to cover it. And it's readily accessible. Doctors are trained about it, et cetera, et cetera. LDN is an off-label use for an FDA approved medication for a different use. So still FDA approved, but it's FDA approved as more of an opioid blocker, right? Off-label means, hey, we're not giving it to you as an opioid blocker. We're giving it to you to help your autoimmune disease, which is something that traditional medicine doesn't even believe is possible. They kind of believe your autoimmune disease is the reverse lottery, right? You've randomly you have this Hashimoto's condition and there's nothing you can do about it except take your thyroid medication, which is not true. I mean, all of us here know that we can influence our antibodies. So we can't look for an FDA approved medication on label to help us with Hashimoto's because medicine still hasn't caught up to the fact that that's even possible yet. So that also means it won't be approved by your insurance. You'll likely need to get it from a compounding pharmacy, which takes that 50 milligrams and it breaks it up into microscopic amounts where you can end up with that 4.5 milligram dose.
Okay, great. Thank you. Yeah, because I wanted people to understand your insurance might not cover it, but it's not an expensive drug. When you get it, when you have to even pay cash for it with no copays, no insurance coverage, it's not an expensive drug. In fact, it's a lot cheaper than almost all pharmaceuticals out there, and it's probably comparable to a monthly thyroid prescription, maybe even less than some. Julia, our last of our prepared questions before we have questions coming in from our viewers, but people know that they can come to Paloma to find thyroid doctors for hypothyroidism care. And our patient coordinators are prepared to help people find a doctor in their state, including doctors who are LDN knowledgeable or LDN friendly. But a lot of people watching are not necessarily Paloma members yet, or they may have perfectly happy relationships with their existing doctors and they're looking to explore further about how to add LDN into their treatment program. How can patients either find a doctor that's willing to do this or convince their doctor to work with them for LDN, and how to prescribe it effectively? Because again, as McCall is saying, we're talking about no more than really about a 4.5 milligram dose. And I know some people even stay on 3 milligrams and do fine with that. We don't want a doctor saying, oh, naltrexone and giving you a prescription suitable for an addiction problem. So what do we do as patients? What's next?
Okay, first I would like to tag on to McCall's last answer, and that is it's kind of an extension to the answer of why doctors don't know about LDN or why they're adverse to it. And one of the reasons is that they're used to prescribing off-label. That's not a biggie. Almost all doctors prescribe off-label, especially if it's gabapentin or, Topamax or something like that. They use anti-seizure medications all the time off-label. However, they're not used to using a drug that's not only off-label, but it's a different dose and can't be bought from their friends, the pharma people, their dear friends, the pharma people. So that was as political as I got married. So they really are, they're like, oh, no. However, there are ways to convince your doctor. And I would like to offer to anyone who is one of the chapters in The Power of Honest Medicine is how to convince your doctor to prescribe LDN if he or she doesn't know about it. I'd like to offer to send that chapter to whoever would like to have it. If you write to me at julia@honestmedicine.com. Again, julia@honestmedicine.com. So now to answer about how to convince your doctor, I'm going to just do a little bit of a summary of that chapter. Basically, what you're going to want to do is this is going to be a hard sell, to be honest. And so I do not recommend what most people do. Oh my God. They walk in with a sheaf of things from the internet that aren't even in order. They're just like that. And they say, here, read it. And can you tell me today if you can prescribe this for me? And the doctors run like heck, But there is a way to do it. And it may not work, but it has more of a chance of working. And that is you do your research and you find articles, as many as you can, that I told you before that he did not get to submit articles, but other doctors are. McCall pointed out that there are lots of things on PubMed about LDN and autoimmune diseases. Print those out and take the very best of them. And I'm going to make another offer. I know I'm sounding like a salesperson here, but there is an article. Dr. Bahari did an interview that I don't know how Jackie, his widow, found a DVD of it. And it was the last interview he did. And it ran about an hour or so. And she gave it to me to put on my website. And by some coincidence, or, I was promoting my book, Honest Medicine, and one person asked if they could have that interview to publish in Alternative Therapies magazine. And I did give that, and Jackie Bahari gave her permission. And it is as close as you can get to a scholarly article, because that's one of the advice, that's the advice I give. Bring scholarly articles. Well, you may not be able to find so many with Hashimoto's. So bring this, and I will also be glad to send that if people write to Julia at Honest Medicine. It's a great interview, and I've underlined here, so you don't want to, but I'll send you one without the underlines. The other way that I would recommend is that there are several LDN Facebook groups. And I don't know how many of you know, but there are actually 3 of them that really are, 2 of them that are definitely related to thyroid disease. There's LDN and Hashimoto's, and that's Brian Haviland and Diana Bailey run it. And I think they're on the call today. And there's Beating Thyroid Disease with LDN, and that's Deb Anderson Eastman. And then Brian just told me about another one that he wanted me to tell people about, and that's Chronic Conditions, LDN for Chronic Illnesses and Infections. And he says that a lot of the people in that group also are interested, have Hashimoto's. And these are places to post. I live in, in say Michigan, blah, blah, blah. Do you know of a doctor who will prescribe LDN? And I think that is a wonderful resource. I don't know how many people who are listening. I know that most of my friends are snobs about Facebook. Oh, I'd never do Facebook. I have gotten more from the Facebook groups for personal reasons and professional. I've even written articles on how to use Facebook to get your message out there that have been published. And, but I can't bother convincing people who won't. In any case, it is a wonderful resource, and I urge people to join these groups.
I could not agree more. I tell my patients there's no place that you can go to find out a larger group of people's experience on one narrow topic in one place.
Yeah.
Like if you want to know what people's experience is with LDN, you've got 35,000 Hashimoto's people in one place on LDN that want to talk about it, so it's definitely something that I encourage too. That's such a good point to make.
Yeah.
Thank you. Well, we've got some questions pouring in from our many viewers, and so I'm going to go ahead and start going through some of those questions. And I think we usually schedule this for an hour. We may go over a few minutes just to make sure that we cover the rest of these questions, but it shouldn't be too much longer. This is a question for McCall. McCall, how long, and I think you may have given us the answer when you said, I'll never go off of LDN myself. How long can people stay on LDN?
You can stay on it forever. So absolutely. I tell my patients, there's more and more studies coming out in support of long-term use of LDN literally every day. I mean, even when COVID was at its peak, a study came out showing its protective nature against more serious cases of COVID. Like so much of our health issues are inflammatory based. And if you have an easy way to mitigate that, I advocate for being on it forever. I'm on it forever. I make my husband take it forever. Like, he doesn't even have a choice.
Me too. I'm on it.
I think I may bet maybe I have to get back on it forever.
I've convinced you, right?
Yes, you've sold me on it, because I mean, even if it's not affecting my antibodies, it may be affecting inflammatory things at other levels, and it might make sense. So
yeah.
Great. Well, that's good to know. We had one of our viewers said that she's on naltrexone as part of the Contrave, which you mentioned, the weight loss medications. But she said, I'm taking a 25 milligram dose. Will I get the same level of autoimmune support, or does a very large dose like that of the naltrexone negate the benefits? This is a patient with Hashimoto's. So she wants to know if taking 25 milligrams versus 3 or 4 milligrams of naltrexone is going to have a negative effect, or if she's not going to get the autoimmune benefit.
So I want to clarify. So Contrave isn't built in 25 milligrams of LDN. Does she mean she's taking that in addition to Contrave, or
I'm
that,
thinking it might be a 25 milligram Contrave. If is that a dose of Contrave that's available?
you know what? I don't know the dose of Contrave, but I
Okay.
know that the naltrexone in Contrave is nominal. It's not very much. So she might be on 2.5 of LDN with Contrave, but she
Okay.
shouldn't be on 25. You know, it's difficult. So as Julia knows, standard studies are done at 4.5 milligrams. It's hard to know what dose is effective less than that, but I have definitely found variability in my patients. Some patients can tolerate less and get benefits. Some patients, especially Graves, often need more to get the same benefits. So if she is on like a 2.5, there is a chance that that could still be beneficial. I just can't speak with certainty.
Okay. Yeah. It looks like I just looked up on the Contrave, and it looks like a standard dose of Contrave has about 8 milligrams of naltrexone. So it's still a little higher than low dose naltrexone. But either way, I mean, what we saw was Dr. Bahari, and the research shows that even larger doses still benefit autoimmune disease, correct?
They definitely can. And what I would say too, in addition to that, is Contrave's just Wellbutrin and LDN. What if
Right.
she split it up and took Wellbutrin and then added LDN to it at nighttime
Exactly.
or during
And
the day? Could get the same benefit plus the security of getting that autoimmune improvement.
And it might be cheaper too, because it doesn't
Right.
have a fancy brand name.
Right. You can
So
count on that.
exactly. Okay. We have another question, and you sort of alluded to this a little bit before, McCall. Is there a difference to how well or how it works in general, LDN, if you take it in the morning versus at night? I mean, you had said that your morning patients had some different kinds of responses, but is there downsides to taking it in the morning or
Yeah.
evening for people?
So most people respond in a way that makes them tired. So one, it makes them tired. It kind of makes them groggy. Two, the peak effort of LDN hits about 4 hours after you take it. And it can it creates that opioid depletion that your body's trying to surmount. So it can leave you flat, kind of a little depressed, little foggy, disengaged. Most people do that surmounting of the opioid depletion like slowly. So you want them to sleep through that. And then they wake up. Most people might wake up a little groggy. I find 20% of people, it wears off either a week or two after you start the medication, or it's very minimal in general. But for the people that take it during the day, almost the opposite happens. They surmount that opioid depletion like that. And so they get stimulated. They feel awake. They feel clear. They feel good. So definitely those people, if you start them at night, which I always do, they're going to wake up during the night. They're going to feel more energetic. Their brain's going to be working. And then you're immediately just say, okay, let's try and take it in the morning. If you start everyone by taking in the morning, most people are going to feel yucky. They're going to feel tired and groggy and not good.
Okay. We have a question from someone who has Hashimoto's. If I get my thyroid peroxidase antibodies, my TPO antibodies, into the normal range, the reference range, after taking LDN, do I need to keep taking the LDN to keep those antibodies there? Would I be in a permanent remission from it? And in order to stay in remission, do I have to keep taking the LDN?
Yeah. So I'm going to give you guys one of my very favorite analogies that I give my patients all the time. Okay. And I'm going to use my handy dandy watered down coffee cup. Okay. So I want you to think about inflammation like water in a cup. Okay. You don't experience symptoms or autoimmune disease until the cup overflows with water. Okay. So our body is made to deal with a cup height of inflammation before it triggers this autoimmune disease, inflammatory syndrome symptoms. Every bit of inflammation that you get is a drop of water in that cup. Okay. What LDN does, if your cup is full and you're overflowing with inflammation, triggering autoimmune disease and symptoms, LDN takes that water level in the cup and it dumps out like 75% of it. Okay. So now you have all this wiggle room to deal with inevitable amounts of inflammation that you're going to get. The interesting thing that can happen in some people is they just need a reset of their water level. They're just sitting here and they can't get it down enough to not let every drop trigger this eruption of overflow of inflammation. So LDN lowers the water level. If you come off of it and your antibodies are low, I'd say a reasonable amount of people, the water level's low enough that if they continue a good lifestyle, they can deal with these inevitable amounts of inflammation without filling the cup up, triggering this eruption of overflow, and creating Hashimoto's again.
Great. Now, one thing we have a question from somebody who wants to know about dietary and lifestyle changes that you recommend to help lower antibodies. So I'm going to put in a pitch here and say, we had an entire speaker series event totally on how to lower your thyroid antibodies. So, and Alex we'll go ahead and put a link in the thread for this particular event. So for people who want to go and watch that speaker series and get the lowdown on that. But just in a kind of the 3-minute version, is there a few extra things that you always tell your patients, McCall, along with the LDN to help lower their antibodies, reduce that inflammatory situation? The questioner asked about keto or AIP or fasting or other types of things. And I mean, I've seen you speak about these various issues. Can you just hit the high points of what kinds of things people need to pay attention to get those antibodies down?
For sure. So this is broad brush, right? I like to take an individualized approach, but if we broad brush it, a couple supplements I love to use. One is selenium. 200 micrograms of selenium daily for 3 months can reduce antibodies. Glutathione, our body's most potent antioxidant, anti-inflammatory agent that we make ourselves. Often when people have active autoimmune disease, they don't have enough glutathione. So supplementing that, big deal. If we wanted to think about food, right? Food is such an important topic for people, and people always want the easy answer. I personally do not advocate for AIP over the course of a long period of time, mostly because I don't ask my patients to do things that I'm not willing to do and haven't already done myself. And I'm not doing that because I like my coffee. But, generally speaking, most Hashimoto's people respond to dairy and gluten negatively. So if you did nothing but test your antibodies, go gluten dairy free, recheck them, you get some really good data on how they improve over time.
Terrific. And then the last question that I've got here is, can you take your LDN with your thyroid meds at the same time? Is this something that we can do with thyroid and frankly, any other meds? Because a lot of people on thyroid meds are also on metformin or antidepressants or other types, cholesterol meds. They're on a variety of different things. So can they continue to take their LDN at the same time? Is there any contraindications?
No, you can take LDN with, most everything except what Julia mentioned. No pain meds, no codeine, no, anesthesia. But aside from that, it's pretty easy to do. I'm biased in this question because I don't have patients who are on thyroid medication that can be taken at nighttime, like only that kind of medication. Every one of my patients is on some form of active thyroid hormone, which means they have to take their medication in the morning and around 2 to 3 p.m. So it would be a waste. One, they definitely couldn't take their LDN in the evening with their thyroid medication. Mm-hmm. For people the 5% who can take LDN in the morning, I would have no problem with you taking your thyroid medication with it.
Okay. We also have another question about somebody who wants to know if it's better to take LDN versus metformin. This is a patient who's on metformin, obviously probably for some insulin resistance or pre-diabetes type of situation, or maybe type 2 diabetes. But is LDN a replacement for it? Can it support it? Is it better than? What are your thoughts about that?
So, they could also even be taking it for just the longevity aspect of metformin. So I'm on metformin and I'm on LDN, not, just because of the benefits to my long-term health. So I think they definitely work on different mechanisms of action. Metformin even has anti-cancer properties, but they're different influences in cancer profiles and growth factors than LDN. So for me, I would say both and, my friend.
Okay, great. That's good information. I think we've had so many people sending so many great questions, and I know there's probably more. And so I invite you to be continuing to share your questions in our community. The conversation will keep going, and we've got so much incredible information to share. And, obviously, as we keep going, we have more and more events coming up, going down the road, talking to various experts. But I have to say, this has been an incredibly informative and wonderful panel discussion. I am just so impressed with our special guests here. And so I want to again thank Julia Schopick. And again, you can find her www.honestmedicine.com and Julia at honestmedicine.com for all of the things that she so graciously offered us as freebies. And we'll have links for McCall and her Modern Thyroid Clinic. And I think it's modernthyroidclinic.com and McCallMcPherson.com. She'll be able to, you'll be able to find information about her as well there. And McCall is in practice in Texas. So if you are in Texas, you can use her for telemedicine or in person if you want to visit her in Austin. If you're out of state, the regulations require you would have to meet her in Austin. You'd have to visit her with her once, but once then you can establish a telemedicine relationship. And of course, we're biased, but we love our Paloma doctors as well. And we serve, I think, almost 70 to 80% of the people in the United States now have access to a Paloma doctor in your state. And so we invite you to connect with our doctors and set up an appointment and talk to them. And our patient coordinators can help you find the right doctor that's a great fit for you. So I think maybe it looks like McCall might have she might have dropped her connection. So we're not going to be able to wave goodbye and say goodbye to her, but she's been marvelous and an incredibly informative guest for us. So thank you, McCall. We appreciate your joining us. And Julia, it's been a tremendous pleasure having you on the show with us too. We encourage people to read Honest Medicine and The Power of Honest Medicine, two really amazing books that I personally have on my bookshelf and recommend to many people. So I'm gonna send it back to Alex to take us out of the hour here.
Yeah, thanks, Mary. I just want to share a couple comments that we've gotten from some of the viewers here. I am learning so much. This panel is fantastic and has answered so many of my questions as a Hashimoto's patient. So thank you again to Julia and McCall for just, I think this is like, one of the most exciting panels that we've had, and really just a lot of like actionable tips for people to implement in their care moving forward. So again, yeah, thank you so much. If you have any continued questions, everyone, you're more than welcome to continue the conversation in the community. That's community.paloma.com. And you can go ahead and continue the conversation there. We will be sending a replay. So if you register to the event, you will get an email with the replay. And then we also will feature it on our website, in the community, and our YouTube channel. So you can always refer back to it later. But again, Julia, thank you so much. And McCall, I'm sorry we lost you, but thank you also as well. If you see this later on.
It's wonderful. Thank you.
Oh, here she is. Let me see. Okay.
Where'd you go?
She's back. She's back.
I was waiting for so long. I didn't know if it was just done.
Oh,
like, okay.
We're just wrapping up, McCall, but we thanked you profusely, and
We did.
Alex said that the viewers are suggesting that this is one of the most informative events they've seen. And, thanks to you both. So we want to thank you so much for participating. And we already said Modern Thyroid Clinic and www.McCallMcPherson.com.
And hit me up on TikTok, y'all. It's fun.
Oh, that's right. She's a TikTok star now. So
yes. Yeah, no, her videos
I don't do TikTok.
You should, Julia. You would be great at it.
You'd be fantastic, Julia.
Okay,
Yeah.
okay. McCall, will you be my TikTok tutor? You like that?
Yeah. I mean, I'm still learning myself, but we'll wing it together.
Yeah.
Okay, I'm on. Send me your phone number.
Okay.
Deal.
All right, everyone. Thank you again so much for both of our guests, Julia Schopick, McCall McPherson,
Thank you.
Alex. It's been wonderful having everybody, and Paloma is really excited to be able to connect with everyone. And so watch for the replay, watch it again. We'll keep you posted on more information.